I'll start off by telling you he was a little American guy. Trace was the most adorable, fun-loving guy. Tried to put a smile on most people's faces. He spent his entire career working for charities. He was born on a farm west of Oklahoma City. As soon as he graduated university, he went straight to his first non-for-profit in California. And it was because of charity that brought him to Australia in the first place. And he fell in love with Australia. Trace was diagnosed with a bone marrow disease called MDS, myelodysplasia. Normally happens in the elderly, so he was a little bit miffed that it would happen to him. We were deeply involved with the decisions on how to treat Trace. There was no decision that wasn't discussed with him or me, and he actually had input into whether he agreed with this or not.
We have a multidisciplinary team approach. We try to involve everybody from the offset to ensure that we've got appropriate allied health, which is physio, occupational therapy, social work, dietitian, and we're lucky enough that we have them all in close quarters on the ward on 9 South, and we did at the time for Trace.
The treatment option for most people is to have chemotherapy, and unfortunately he was in the group of others where the only option left on the table was to have a bone marrow transplant.
The usual duration for a treatment for a stem cell transplant is in and around 30 to 35 days. That involves they come in prior to what they call day 0, which is when they get the cells reinfused, and patients can receive chemotherapy for a number of days leading up to the day 0, and we expect them to be admitted for another 2, maybe 3 weeks post that day 0.
The team that supports haematology patients is a very comprehensive team, and there's a professional for every aspect of what the patient will go through, whether it's dietitian, physio, occupational therapist. And then we also look at what supports might be available for people after the transplant, if they need help at home or if they need transport.
The entire team that work on that bone marrow transplant ward, they run like a well-oiled machine. It's not just the doctors, it's not just the dietitians, it's not just the social workers, it's the cleaners, it's the dinner ladies, but most importantly, from my observation, it's the care that he gets from the nurses that was just a standout. They're the people that are there 24 hours a day, constantly looking after patients just like Trace.
Every time I went in to see Tracy, he always made me feel incredibly welcome. He'd always say, sit down, come in, come in. He just made it so easy because he was so accepting of everyone and his situation.
Trace unfortunately had what we call graft versus host disease of the skin. So we tried to manage it from a number of different fronts. We had the pain team involved, we had the wound care team involved, we had a number of different specialties involved to try and optimise his care. We were able to allocate nurses 1-to-1 to look after Trace, and on occasion that was 2-to-1. And I suppose the difficulty from the nursing perspective is while all this was going on, Trace was still in a lot of discomfort and a lot of pain. After MDT meeting, the decision was made that we'd have to go down the palliative route.
Especially towards the end, there was constantly a team of medical practitioners around him. The care he received was just incredible. He needed someone to be with him 24 hours a day, so they ended up converting the nurse's station into a bedroom for myself and his sister Brenda. I know they lost their office for a week or 2, but it was very, very greatly appreciated.
Our role involves not only the patient but the carer and the family, because the stress is often greater on the carer than it is for the patient, because they're the ones that are watching the person they love suffer, and that's obviously very difficult.
Although it was a tragic set of circumstances, Trace ultimately passed away on the ward with all the staff who cared for him and established such a connection with him. It was a very emotional time for everybody.
There was never a time where we couldn't just open up his door and there would be someone stationed right outside to tell us what was going on. And more importantly, they told him what was going on at every step of the way, and that's really special.
I'm confident that the nursing staff were able to deliver a high standard of care. I think we approached it from a holistic point of view, with all the MDT, allied health, nursing staff involved, and not just Trace, but also his loved ones as well. And although it was a tragic outcome, I feel that we really did our best to ensure that we had a peaceful death and a peaceful passing.
Nurses by nature, I always assumed are going to be caring and loving, but the care he got, what I witnessed, it changed my life, and I know it really helped him towards the end of his.